How monumental a task is this, Dr. Kessler, vaccinating the entire country?
It's the most monumental task I think the country has faced, maybe in decades, maybe in its history. It is absolutely essential. We're going to get it done, but it's going to take some time.
What kind of infrastructure was left for you and the other officials who are in charge of this logistical task?
I think there was good work on the part of the scientists at the NIH, the companies. There was work done on vaccine development that goes back now 5, even 10 years into the new scientific technology, but there really wasn't a plan to administer these vaccines in arms. The people there, the career scientists, the people working at the companies, they were working day and night. They were very dedicated to the public health, and I really an honor to work with them. And we're going to make this vaccine available to everybody who wants it as soon as possible.
Where are we in the process, and what does the road ahead look like?
So, our goal, as the president has said, is to have 100 million doses in the first 100 days, but we're not going to stop there. And I would hope by midsummer, as the president has said, that we have enough vaccine to vaccinate everyone over 18 years of age who wants the vaccine. The states are involved. Each governor has mobilized their resources from hospitals to clinics to mass vaccination sites. But on top of that, the president has directed that we play an aggressive role, the federal government. And as soon as the supply increases, we will have more and more vaccination sites.
How concerned are you about people who do not want to get the vaccine?
I am very concerned that there are people who have a lack of trust, who are hesitant, who don't feel comfortable getting this vaccine. It's one of the reasons why we changed the name and took Warp Speed out of Operation Warp Speed, because it's very important that people understand that the studies that were done are full phase 3 studies. They're randomized, double-blind studies. They are the gold standard. And so we really have a lot of safety data. We have efficacy data. So there's no rush in the studies themselves. And people have to have confidence. The good thing, knock wood, I study all the adverse events, and I am seeing nothing here that gives me any great pause.
Even when people get vaccinated, they are going to have to continue being careful, wearing masks, social distancing. So if the goal is to vaccinate everyone by the summer, how long will they have to keep practicing social distancing, et cetera?
The reason for that right now is that we need more data. Just because you can prevent death and hospitalizations with the vaccine, it doesn't mean that we know exactly whether that translates into a decrease in transmission. But the thing we do know is if you get vaccinated, that's going to prevent death and hospitalizations.
How worried are you about the possibility of another pandemic, Dr. Kessler?
Your question is not just another pandemic, but what about variants here? And I think we're learning more. It is humbling. There's no doubt that this virus does mutate. That is normal. There will be changes. But the key to me, Katie, the most important thing right now is that certainly with the Moderna and Pfizer vaccines, the important thing that I am seeing with either the current variant or the variants that we've been talking about, the UK, Brazilian, and even the South African variant, these vaccines seem to prevent hospitalization and death. The good news is this technology, these mRNA vaccines, we can swap out the template so we can make sure that any vaccine is potent and specifically designed for that variant. It'll take a number of weeks, but it does not have to take months or years to get a new vaccine to the American people, and we have to build that capability.
How do we restore faith in science and in our medical experts?
What I would hope, Katie, is that there's a generation of young people today that will have lived through this experience, will have seen what can be done with these scientific accomplishments, with these vaccines, and hope that they make a career, whether it's biomedical engineering or medicine, and say they want to dedicate themselves to making sure that people in the United States and around the world can be protected, because they will have lived this experience firsthand.